Hello students, welcome to this session. Let's study respiratory system. Learning objectives are 3.1 respiratory tract structure, 3.2 lungs, 3.3 mechanism of respiration, 3.4 some definitions like vital capacity.
Hello students, today we will see about respiratory system. So what is a definition? It is a system which includes the parts which required for the air passage and lungs where gases exchange takes place. So functions of respiratory system is mainly respiration and voice production because of the presence of the larynx in the respiratory system. So these are the parts of the respiratory system. In this diagram you can see. So it continues with the nose, then pharynx, that is nasopharynx, then larynx, then trachea, that is a windpipe, and then bronchus. There are two, right bronchus and left bronchus, and then bronchioles, and then it consists of the lungs.
Lungs. The two lungs are essential organs of respiration. They are soft, spongy, and elastic structures. The lobes, right lung has three lobes and left lung has two lobes. Location, they occupy most of the thoracic cavity. Each lung is conical structure with its base resting on the diaphragm and apex directed towards the neck. The alveoli, with each inhalation, air passes by way of bronchial tree to alveoli. Air and alveolar sac is made up of simple squamous epithelium surrounded by blood capillaries. Gas exchange occurs between air in the alveoli and blood in the capillaries. Oxygen diffuses across the alveolar and capillary walls to enter the bloodstream, while carbon dioxide diffuses from blood across the walls to enter the alveoli. The alveoli must stay open to receive the inhaled air if gas exchange is to occur. The alveoli are lined with surfactant, a film of the lipoprotein that lowers the surface tension and prevents them from closing. The lungs collapse in newborn babies who lack this film, and condition is called infant respiratory distress syndrome and now treatable by surfactant replacement therapy.
So covering of the lungs, there are two coverings. It is called as pleura. So inner visceral layer and outer parietal layer, and the space is called as pleural space, and in that pleural fluid is present. And function of pleural fluid is mainly to lubricate this pleura and the protection of lungs from injury shock, and then gives nutrition to the lungs. Breathing movements in man, so it is a mechanism in which two movements are there, that is inspiration and expiration. So what is inspiration? It is intake of the air, and expiration is expulsion of the or removal of the air. So in that, the diaphragm, intercostal muscles, ribs and sternum, these are the parts mainly required for the breathing mechanism. So in that diaphragm, in inspiration it is an active process, and expiration is a passive process. So in inspiration, diaphragm contracts and it flattens, and expiration, diaphragm relaxes and it moves upwards. Then intercostal muscles contract. In expiration, intercostal muscles relax. Then ribs and sternum. So in inspiration, ribs and sternum moves upwards and outwards, and in expiration, the ribs and sternum moves downwards and inwards. So in this way, inspiration, in that thoracic volume is increased and pressure is decreased, and therefore air is moved in. म्हणजे व्हॉल्यूम वाढतो, प्रेशर कमी होतं आणि मग हवा आतमध्ये येते. जसं आपण फुगा फुगवताना आपण व्हॉल्यूम वाढवतो आणि मग हवा आतमध्ये जाते. अँड देन इन एक्सपिरेशन द thoracic volume decreases because air pressure increases, and then air is moved out. So like it happens in a balloon, की ज्याच्यामध्ये आपण बाहेरून प्रेशर दिला तर हवा बाहेर निघते. So this is in short inspiration and expiration. Thank you.
Tidal volume is the volume of air moving in and out of lungs with each normal breath is called tidal volume. It is about 500 ml. Vital capacity, the lungs are filled to maximum capacity by enforced inspiration. The volume of air 4 to 6 liters in the lungs is called vital capacity. The forced inspiration usually increases the volume of air beyond the tidal volume by 2900 ml, and that amount is called inspiratory reserve volume. We can increase the amount of air expired by contracting the abdominal and internal intercostal muscles. This is so-called expiratory reserve volume. This is about 1400 ml of air. Vital capacity is the sum of tidal plus inspiratory reserve plus expiratory reserve volume. Residual volume, even after enforced expiration, some air always remain in lung. This is about 1.5 liter. This is called residual air. The residual air ensures that some carbon dioxide always remain in our circulation with each breath. This air is not as useful for gas exchange because it has been depleted of oxygen. In some lung diseases such as emphysema, the residual volume builds up because the individual has difficulty emptying the lungs. This means that the vital capacity is reduced because the lungs have more residual volume.
Hope you find this session useful for your understanding and for your exams. Thank you.